Hello again. The World Health Organization has said countries with the highest vaccine availability should share out their doses with the rest of the world. A spokesperson singled out the UK, which has inoculated more of its population against COVID-19 than almost any other nation.
We're asking all countries in those circumstances to do that. Hang on, wait for other groups. Wait for those other groups. We'll also appeal to all the people of the UK. You can wait.
Well, to discuss this issue, I'm delighted to welcome onto the programme Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School, Marcello Ferrada de Noli, an epidemiologist and the founder of Swedish Doctors for Human Rights, and also Alan Peter, a pulmonologist in Johannesburg. Gentlemen, you're welcome. Bharat, can we start with you? Whether or not this is a good idea, is there any chance, do you think, of the UK agreeing to it and halting its vaccination programme essentially to help other countries?
I doubt it very much, because you need a kinder, gentler political system, and Britain post-Brexit finds itself in a difficult position to take that magnanimous view of we are all in it together. That Sanskrit concept of Vasudevai Kutumbam, meaning the whole world is my family. So I find it very difficult, although it is very essential that we immunize the globe together. Otherwise, you can undo the gains that you gain from immunizing just your population.
Marcello, the WHO is saying the UK should go ahead and inoculate vulnerable groups first. Almost all the people dying are in those groups. So is there any sense in vaccinating young, healthy people in the UK while people overseas are at much higher risk?
Well, they're partly right in saying that the vaccination program should be extended to different parts of the world, but I would not agree with that the solution would be the stopping or decreasing the impetus of the UK vaccination program. What the World Health Organization should instead advocate is a call for increasing the production of the vaccines in order to be distributed in other countries, and particularly in countries with less advantaged economies. They would, for instance, have the benefit of vaccines which are not so expensive to store, and they might be equally or even they would have a higher clinical reliability. So I don't think that the solution put forward by the suggestion by the World Health Organization to decrease the programs in the UK, that is not the solution for the global pandemic now.
Alan, if we take the example where you are, South Africa, it's got the highest infection rate on the continent, but the vaccination programme, it's got off to a slow start compared to the African Union, etc. They've been able to accumulate cheaper jobs than Johannesburg. Whose responsibility is it to fix this?
Well, I think what they have admitted to is that the government was slow in getting prepared for ordering and buying the vaccines. I know that South Africa has just ordered 1.5 million AstraZeneca doses at twice the price. This might be because they have ordered very late. There's also Morocco has ordered a lot more vaccines than South Africa has done. But I think that's just due to the infrastructure and the administration on our side from our government.
Bharat, to something you said a little earlier, the British government, does it not, like any other nation, have a responsibility to its own people? You know, what would citizens, voters think if British lives were lost due to vaccine doses going elsewhere? It's an important point, isn't it?
Of course, it is an important point, and that is why I said it would take a very unusual and very brave and a very magnanimous politician to say we are going to immunize our sensitive groups and then share the vaccines. On the other hand, I feel there is good news, because the United Kingdom has ordered more doses than it needs for its population of roughly 70 million. And one of the options there would be that whatever spare capacity it has got, it shares it with more vulnerable nations, nations where they have uncontrolled, extensive spread of infection. So all is not lost here. But I would also like to say that the United Kingdom, the European Union, and the United States lend the technology to set up additional plants to increase global capacity, global manufacture, to immunize people across the globe by manufacturing more.
Okay, we might pick that up in a moment, but Marcello, another issue I want to talk about, the risk of new variants emerging. If countries just focus on inoculating their own populations, does that increase the danger of seeing new strains coming in from elsewhere? So in essence, by not sharing their vaccines, perhaps their production, it's going to be worse for those countries in the long run.
Indeed, the risk might increase, but the sharing of the vaccines, I don't think that countries are sharing their stock of vaccines. I think that the multinationals which are producing these vaccines, and then the agencies which are regulating whether a vaccine is approved or not approved, and then the World Health Organization, and then the government which are associated with each of these international companies. I mean, all of these instances are going to decide the amount to be produced and where it's going to be distributed. So I think this is something that has to be taken by internationally, by international organizations, the regulation and the decisions, why not the United Nations, about this delicate issue. It's not a matter of the country that would share, the vaccines they have already got. In the UK, they have already vaccinated about 12% of the population, which is nearly 5 times more than in Sweden, and Sweden represents more or less the average in Europe. That is a good thing. Okay. That the same thing has to be extended to other countries, but the solution is not to deprive the vaccination programs already rolled out in these countries.
Alan, what do you think of, I'm hesitant to call it criticism, but perhaps singling out the UK by the WHO, saying that they should be doing more for the global community? You've got Israel, you've got the UAE, they've vaccinated even higher percentages of their populations. Do you think, Alan, is there a sense of politics at play?
I'm not sure, but I mean, just from a humanistic point of view, if a country, and I don't know the UK figures, but if a country buys 4 times the amount of vaccines than its population, one has to ask questions why. Referring to the last question, as we get mutations, and more mutations will occur, that is the natural life cycle of any virus. We hope that the production of the vaccines using the same technology, the messenger RNA, they'd be able to take these spike protein variants and make newer vaccines. But coming back to the politics at play, honestly, I find it difficult to understand why a country would have so many vaccines. Okay, if you're going to give 2 doses, you obviously need double your population, but to have 4 times what you need is excessive. And coming back to your figure, when you're saying that South Africa has got the highest infection rate, one has to remember that in Africa, the observation and the epidemiology and the studies looking at facts and testing in the rest of the African countries is not nearly as developed as South Africa. So we really don't know the extent of the coronavirus deaths in Africa. One of the things in favor of Africa is that we have an inverted population pyramid where the majority of people are actually in the younger age groups, whereas in Europe you have an inverted pyramid and most of your population are sitting in the very elderly age groups. And that's maybe one of the reasons why Africa has got a lower incidence and a lower death rate from COVID.
Okay, we're just going to have to wrap up, but we have around a minute left. If you want to maybe leave with a sentence with your views, just so we know where you stand, just starting with you, Bharat.
We have to work on this matter on a global pattern rather than individually. I know politically we have to look after our population, but we need to bear in mind that this is a global thing and we need to work globally.
Marcello?
The vaccination programs do very, very much in order to defeat the virus. It should be continued, and the more people are vaccinating, the better. So that has not to be stopped. What has to stop is the geopoliticizing of the whole process in the producing and distribution the vaccine. That has been from the very beginning. We have to stop with having a profit before the public health benefit in the consideration how to distribute the vaccines.
Alan, the last word to you.
We have to overcome vaccine ignorance. So the people who don't want the vaccine, this virus is going to be with us for a long time, and we may be taking a COVID vaccine yearly.
We've been speaking to Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School, Marcello Ferrada de Noli, epidemiologist, founder of Swedish Doctors for Human Rights, and Alan Peter, pulmonologist in Johannesburg. Thank you all.